Is it doing it now?
Mm-hmm.
Really? I don't see any red light or anything. Oh, okay, it is doing it. Okay. So, chapter 3 is also a pretty simple, more descriptive chapter, so I won't spend too much time, but we can just check what could be ideal cases for CBT, because it's time limited. If the person is too severely impaired, they may need more longer term therapy and more multimodal therapy. So the not too severely impaired patients and who have relatively good resources would be good, like good health and more focused acute anxiety rather than chronic long history anxiety. And also, if the person has depression, better be non-psychotic depression, because actually for psychosis they may require psychopharmacotherapy as well. And also, because it's a talk therapy, they should have good verbal skills. And then there's some, at least limited success in relationships, because it's based on very kind of outcome-oriented, efficient relationship. So if the person takes a long time to build any kind of relationship, then it may be too slow for CBT works, because CBT, you need to build trusting, efficient relationship pretty quickly and then just dive into the work. But if the person takes a long time, and if the person requires quite complicated process of building relationship, then it could be hard to do CBT. Also, what we realize a lot in research is that the person should have reasonably organized lifestyle, because there will be a lot of homework, it will be weekly sessions, and if you miss sessions repeatedly because it's structured, it's not really good. So, and also you should be able to do homework on your own. So some verbal skills and some written skills and some life managing skills. If the person's so severely depressed they cannot even get out of bed and take a shower, it will be hard for them to do CBT. Yeah, so you need to look at those aspects. And then definite contraindication of CBT would be patients with severe antisocial personality disorder. We don't really have good CBT method for that personality disorder in the first place. And then if the person has antisocial personality disorder, it's very hard to build any trusting working relationship. So we won't expect any good outcome. And then malingering or other conditions that markedly impair the development of collaborative therapeutic relationship. So it should be trust-based and very quickly building trust-based relationship. The person should not take too long to build trust-based relationship with the therapist, because it's a short-term therapy. And if the person is malingering, then what's the point? There's no trust. Also, cognitive impairment would be a problem. It's cognitive behavioral therapy, but if the person's cognition is impaired because of advanced dementia or severe amnestic disorders, delirium, or drug intoxication. So those kinds of cases, contraindications of CBT. And these are the dimensions you want to consider when you assess for CBT: the chronicity and complexity of the symptoms, and optimism about therapy outcome. My previous research showed that actually the expectancy of the patient that this therapy will help them was actually 30% of the therapy effect. So you want to have optimistic person. And if the person, the patient thinks that even after a few sessions, oh, I don't think CBT is going to work for me, then better to switch to some other method, because the patient's trust and optimism is very important. And also they should be responsible for their changes. They feel the responsibility for changes. And then they should be at least agreeable with the CBT rationale. Depending on their cultural background, they may not agree about all the CBT rationale. Even if we try to reason with them with the cognitive errors and cognitive distortions they are showing, if they think, oh, this is who I am, you know, who are you to tell me about how I feel? This is how I feel, then the person is not comparable with the CBT rationale. Also, the person should be able to access their automatic thoughts and their emotions. That's also a kind of basic skill, and some people don't even have them. Then capacity to engage in therapeutic alliance. So you should be, the patient should be collaborative and should have positive attitude about working together with the therapist, and ability to work within the problem-oriented focus. So some capacity to remain in the focused area is important. So like the patient who just tend to talk about all different things and cannot focus on one topic, they may not be a good candidate for CBT. Although I've done that, and then also we use CBT skills to keep the person focused on the area, and that's doable, but may not be ideal candidate. But just think about it, because that's why I'm saying you want to have many different tools in your toolbox. You should not be thinking, oh, I got a patient with panic disorder, okay, I'm going to do CBT. Yeah, you need to look at many aspects of the person's situation and personality and behavior pattern, and then decide. Okay, this is your textbook and the case formulation worksheet. I was going to do it in the class, but then I thought that it may take too much time. And then also you guys, at least students who took my counseling skills class, did a case formulation.
We used this a little bit. Remember, you guys, that our textbook was with Steve last year, was CBT oriented entirely.
Oh,
and it did have this pattern of case conceptualization.
Yeah.
Yeah.
Yeah. Okay. Yeah. That's what I thought, because I used that textbook, case formulation textbook, the treatment planning chapter. Remember, you guys were in my class,
That's right.
and then you were in, you guys in Steve's class, and so it's kind of similar. So we kind of did it in the counseling skills class. So I won't spend class time doing it, but this is the very typical CBT case formulation.
The situational issues, are those just like, I don't know what, contingencies, things that, I'm never really clear about that.
The situational issues?
Yeah.
It's more about like really, literally their situations, like job loss, divorce, those kind of things.
All right.
Yeah.
All right.
It's really those kind of things. It's kind of quite different from psychodynamic case formulation worksheet. They tend to focus on a lot of childhood events and trauma and their interpersonal pattern, things like that. But here it's more straightforward, and the situational issues means their situational stress. Okay, so this is it. If you have some spare time, there are a lot of samples in the textbook so you can practice, but I think you guys did enough in the counseling class. So